I'm just going to do it right now. There we go.
There you go.
We got it. Good morning. And Dan, thanks for that good reminder. We'll ask people to use the chat.
Sure.
Um, I don't know. Do you think our attendance will be stronger with school this week? I don't know. Good morning. Good to see you all. Thanks for being here.
Mary, Dan, Cindy, I'll just say really quick, my new hire will be on today. Ivy, she'll be joining in a few minutes. We were going to be together, but I've got childcare issues, so I'll be in the office a little later, but she will be on soon. No need for formal introductions, but just wanted to point out that you'll see her name.
Great.
Nice.
Thank you. Wonderful. Exciting. Look forward to meeting. Good morning, everyone. We're going to get started shortly. Love for you to just drop in the chat name and agency, and yeah, that'd be great. And then we'll get started shortly. Just see if we get, as folks come in, that'd be great. Yay, some more coming. Yay, slowly but surely, we're all coming in. There we go. Um, Good morning. Good morning. Great to see everyone. Happy shorter week. If I haven't reminded you, or I will remind, we record these. So if there's something in this session, you're like, oh, we need to see this again. When the meeting notes are sent out, the link will be in that. So if you're like, oh, I want to revisit, you certainly can. Or some folks have used these in training with their teams too. So keep that in mind as if that's a good resource too. Cindy, I just have a couple more I see coming in. And friends, if we could just do that reminder, please introduce yourself in the chat. And then at the very end, we'll have time for that circle go around where people can share agency updates and all that good stuff. Do I have more in the waiting room? We had a great attendance this morning. Super important topic, right? Cindy, would you like to introduce yourself and run? And like I said, thank you all for being here. It's being recorded, and at the very end, we'll do agency updates. So thanks.
Sure. Good morning, everybody. I'm Cindy Parsons. I'm with the Connect Center. And today we're going to be talking about people in Washington County that are unhoused. Let's see, our panelists, Brianna Keeley is from St. Andrews. And we also have Sarah Triple here that will be talking about community services and what our Washington County is doing for the unhoused. And do I see Jacqueline Bayless? I don't see her on here. Um, if she is not joining us this morning, I can fill in with what I know with homeless school liaisons. Um, so I think we could go ahead and get started. And then I'll be talking about what the Connect Center does with, especially with youth that are unhoused. Sarah, would you like to go first and talk about, well, exciting news, of course, and, and just all that host team and everybody at the county is doing to help people in our county that are unhoused?
I can. Is there a way for me to share? Do I have access? I am not familiar with Zoom. So do I have permission to share? Okay. Let's see if it'll go. There we go. Oh, and then I lose you all. So if someone could just say that you can see my screen.
We can't, or I can't.
I can't.
Okay, that's fun.
You could just draw for us, Sarah.
But I'm not, I don't know. It's so, okay, but now how do I get out of this? Okay, now do you see me again? Or you
Yeah,
still see just my blank
Sarah, try
screen?
again. Maybe I had a wrong setting. If you want to try again, hon.
It looks like I'm still, is it there now or no?
No.
No. If you'd like, I am happy to start because I don't have any screen to share. And
Okay,
then if you want to keep messing around and if it pops up, then you can just leave it up.
okay. All
And
right, you go
I
ahead.
also see that Jacqueline is here, Jacqueline Bayless. So
Oh,
she'll also be talking with us about the schools and what they're doing with unhoused youth and families and students.
I also don't have to start if Jacqueline wants to start too. I wasn't trying to hijack anything. Okay. Okay. Good morning. I am Brianna Keeley. I am the director of St. Andrews Community Resource Center. We are located in Matamidi, in Washington County and at St. Andrews Church. We're technically a ministry of St. Andrews Church, a mission of the church. And we've been open since about 2011 to serve families in our community. I'm just going to give like a little overview of what we do, but then I'll dig more into the sheltering piece and how we assist families who are unhoused. So we are open Monday through Thursday, 9 to 3, and we serve the wider community with basic need items, clothing, and food. People can come and shop once every 30 days, and we do have some exceptions within that, but that's really just to make sure that we are distributing our resources fairly, I guess would be the right way to put that. We also provide case management services, a free community meal every Thursday. We have employment mentoring, and then have some referral partnerships for things like Bridging, St. Paul Foundation, or I guess the Community Sharing Fund, sorry, and a few other things there. So that's kind of like our large overview. We see about this last fiscal year, which ran from September to August, we had over 2,700 visits throughout the year. And that was just one shy of 1,000 families, distinct families that were visiting us. So we served 999 families this year through our basic needs, which it continues to increase every year. And so really we don't see patterns. We see like a trajectory of this that kind of continues to go up. We do also offer rental assistance. We used to offer to parts of Ramsey County and Washington County. Due to the higher need that we're seeing, we have limited that to only Washington County, as we want to make sure that first we're serving the community and kind of sticking towards our mission there prior to branching out to the greater community. We also, this last year, were able to increase our amount that we give to our rental assistance. So when I came in about 3 years ago, we were at $500 per family that we could assist with, and that was only once every 18 months. And now we've increased that to $1,000 per family once every 18 months. So that has also been, I hope, helpful in eviction prevention. It's definitely, we saw many families with a higher balance, and so just trying to figure out the best way to navigate that. In terms of our sheltering program, we do receive between 300 and 350 calls a year for shelter. And we serve only families with minor children in the home for shelter. So we're very focused on families. There does need to be a minor child in the home. And we so we're the only sheltering program. We've just recently shifted our model. So it used to be a single family home community living model. in Hugo, and we've now shifted that to families are in hotels. We have a contract with extended stay, so families have independence with their food and their cooking. They have independence in no curfew, and are also required to check in with their case manager and held to goals and achieving those goals and working with their case manager consistently. The families in our sheltering program do receive I would say, very intensive case management. We serve 4 to 5 families in that part of our program at a time, and what we have seen is families come in with more and more needs. I would say majority of every new family we see, there's a lot of layers and a lot of barriers. We've been seeing a lot more long-term homelessness from families, so with that comes more barriers and kind of harder to get back to stability. We shifted our program so we could kind of provide more transitional housing for our families. So our program is a 90-day program. And what we were finding is many families were not leaving the program successfully. There wasn't that 90 days, wasn't enough time for families to really find what they needed and or get back on their feet financially. And so for those who are working their goals through the 90 days and saving money and doing all the things and working towards it, but just are not quite there. We have our transitional home now in Hugo, and I have our first family moving in there December 1st, which is very exciting. And the goal is that we'll have one family, possibly two, depending on family dynamics, that will be living there independently. So it'll be less intensive case management, as they've shown that they are more self-sustaining, but still being held accountable to goals and the ability to check in for support, as well as just kind of have the full support of our community resource center. We've also recently re-upped our partnership with Peace House in Stillwater, and so that's another piece of our program in terms of transitional housing. So families, they have to be single mothers who have completed our 90 days or shown enough self-sufficiency. We use a self-sufficiency rubric as well as tracking toward progress towards goals that they would then be referred to Peace House. And so we work collaboratively with those that run Peace House and to refer families there. We do have one family there now. It has been somewhat of a slow start, just because we want to make sure that the families that we're placing have enough self-sufficiency to be successful, and that my staff, I have 2 case managers, have enough capacity to provide the case management support. We also are super fortunate to have been working more, I think more than in the past, and maybe I'm wrong, but since I've been here, I guess, in the last 3 years, more with the county where they're helping us support overflow hotel stays for families now too. And so that's been really great. Sarah's been great to work with, and Amy, super communicative. And so we're working on contracts with them to, we shelter families in hotels as, I would say it's more of a respite in terms of we don't know if we'll have an opening or not, but we've had, I would say, at least 3 or 4 families who've then been in a hotel for 2 weeks and then transitioned in with a little bit lighter case management and then transitioned into our sheltering program. And so that's just given us another avenue for more shelter for families. With that, this last year, I believe it was around, I might have my 32, no, maybe it was 35 or so families that we were able to shelter in hotels, and then another 17 through our sheltering program. So we were able to provide shelter to 52 families, which is a higher number than what I've seen in the past. And so our hope with the way that we've now kind of set up this model is not only will be able to provide more shelter to more families, but longer term shelter and more case management. So I think that's pretty much the overview, but I'm ready for questions or comments.
I have a quick question. Good morning.
Yeah. Hi, good morning,
Sorry,
Dan.
did you say, and I missed that the extended stay hotels where families stay and the transitional home, is that all in Hugo?
The extended stay is not. Extended stay is
Okay.
in Woodbury. Our
Okay.
transitional home is in Hugo.
Okay. Thank you.
And our sheltering program is families must have ties to Washington County. What we've seen is, and again, coming back down to kind of the roots and the mission of our agency of St. Andrew CRC is that we're serving our community, which is Washington County. In the past, we've been able to be more flexible, but because of the higher numbers that we continue to see, we're in Washington County. We want to make sure that a family has ties to Washington County. And with that, it's schools, benefits, last address, things along those lines, that would make a family have ties to Washington County. Anything else? Can I talk about what our biggest needs are?
Oh, yes,
Do
please
I get to throw
share your
this in
biggest
here?
needs.
Okay.
Yes.
I mean, all to say, we have seen such an incredible increase in the amount of people that we're serving. When I and started, I feel like a broken record at all my meetings, and the people who are at every single meeting, like Cindy, that I am, probably hears me say this 75 times. But like when I started, a high number for a month of families coming to us was 75. October, we served 295 families coming through our doors. And just to remember, that's about in 16 or 17 days in a month, depending on how the month falls, that we're open Monday through Thursday. And so with that, this last fiscal year, we gave out about twice as much food as we did the year before, equaling around 95,000 pounds. So we always will take monetary donations for food. We also find diapers, wipes, baby items are such a huge need and necessity, especially baby wipes, not only for many families and many people even who don't have children will ask for baby wipes because it's a way to kind of wash themselves, especially if they're living in their vehicle or just kind of need a quick freshen up. We do provide laundry and a shower on site too. I forgot to mention that. So we are available for people to come in and go ahead and do that if that's a necessity. So, and then other just like basic need items. My program manager is working on connecting with different agencies. So say like you work for 3M and your office wants to do something for the good of all people, then please connect with us and we would be happy to set you up with like a bin and all the things that you would need, and we could come pick up donations and things too. So we are looking for partners who would be willing to partner and just commit to 1 month a year that would help stock those shelves. New socks and new underwear for all, including adults, is very high on the list as well. So those are kind of some of our big needs there. And then volunteers. All of the shopping is run by volunteers. We have a very small staff. I have three of us who are full time, and then I have another three who are part time, and four who are part time. And so the volunteers are a really large piece. Volunteers can work and they help people through shopping in 3 hour shifts that they commit to once a week, or you can be a substitute. And there's a few other volunteer opportunities too, just for individual things throughout the year. We did just do a Thanksgiving like distribution. Jenny O sponsored us and gave us all of our turkeys for free, which was amazing. And that's the first year we've gotten that. So that was a huge savings for us. And that's also really run by volunteers and my volunteer coordinator. But so there's lots of opportunities like that. So I will also I'll put my email and contact in the chat. If any of those things sound great for you, I will connect you with the right people. So thanks for listening to my little spiel.
Thanks so much, Brianna. So many
You're
different
welcome.
ways to get involved, and you're just doing so much there. It's just so wonderful.
Thanks. Thanks.
Well, we like to try again, Sarah? Go ahead.
We can see if this will work now.
Oh, yes, I think it
Did
is.
that work now? Okay.
Yes.
And then I can see you guys somewhat too, so that's a little bit helpful. I don't go quite black. So my name is Sarah Triple. I am a division manager in community services over what we call our community resources and partnerships division. So I oversee our housing area, transportation, community engagement, and adult foster care. So kind of a mix of services there. And while I have this on my screen, I'm just going to point out this needs to be updated, but right over here is where there's a brand new big building, and I'll show you guys some pictures in case you guys weren't able to make all the open houses last week. So our housing team is comprised of our homeless outreach services team, and then we have we have housing planners in addition to that. So Host mans a voicemail line that's up there, 6484, to answer during business hours. And so they can help folks access services, solve some housing problems, find affordable housing, connect to rental assistance, etc. We also have two staff that do street outreach. They're out several times a week throughout the county, mostly knocking on car doors, trying to connect with folks. So if you see folks in a parking lot or somewhere that you are suspecting, maybe living out of their car or maybe homeless, feel free to reach out to the host line, give them that information. And the next time they're out, they will try to swing by and make that connection. We also have someone who is present in court for evictions. So our court process switch. So it's 1 hour Monday through Thursday that they do set for evictions. And so we do have a staff who sits in a breakout room trying to connect with folks. And we also have SMERLs that are there as well. So trying to provide some legal assistance to help folks make good deals and see if we can't get what they owe down a little bit and make that more affordable. And then if folks qualify primarily with having some sort of mental health diagnosis, we will provide ongoing housing case management for folks that are willing to work with us. Amy Blair works underneath me. She's our housing and homeless manager, and so she oversees our planners. So we manage almost everything we do related to housing is funded by grants. So very complex fund grants through the state. So they manage all that. They do a lot of our regional meetings. They stepped up and led our emergency housing services building development. And then I think many of you are aware, Jenny Mason does a lot of the coordination across our partners for the rental assistance. So a lot of the rental assistance that we get, we contract out into the community. So the one thing and I don't, maybe most of you are familiar with, primarily it's going through 211. So if you have folks who are needing direct prevention assistance, 211 opens 1 day a month to take applications. And someone else will know it. I think it's the second Tuesday of the month that they open for that. And our providers right now are Solid Ground, CAP RW, and Valley Outreach. I stole this from a board presentation, so I'm just going to I have EHSB next, so I'll get into some pictures, so I'll do the update next. But I don't know how connected you guys are all to housing, but there was a Medicaid service, Housing Stabilization Services, that was terminated at the end of October due to fraud. And uh, it was sad to see this go. This was a cool program for folks. It allowed them to use straight medical assistance to both find housing and keep housing. And so we're still kind of seeing what the reactions, kind of what the after effects are going to be. What I see happening is it'll kind of slow down the process of people getting out of emergency housing, right? If they don't kind of have that dedicated person to really walk alongside them in that process, it will slow that down. So we're watching that. But if those of you were aware that program or know of folks, who had that program, it did end. As Brianna already alluded to, we're working to do some expansion with St. Andrews. We went to our board last year with some of our new funding sources, and the one piece they're wanting us to explore now that we're going to have, now that we have this thing for adults, they want us to focus somewhat on families. And so we've been having some initial conversations with St. Andrews. to do some of that expansion and see if we can't help do that. And then we'll start this year figuring out, is there some more permanent solutions to help build a capacity for families, whether that's more upfront or whether that is in that emergency housing area. So far, what I think one of the things y'all are going to be interested in is our rental assistance resources are significantly decreasing. So, we had a huge spike in funding during COVID, and that is slowly now ending as all these one-time fundings and all this extra grant money is slowly going away. So in 2025, we distributed just over $660,000. That probably includes a little bit of the support services to get the money out the door. So we and our community partners served 235 households or 715 people. And right now, the average that we're seeing per household is just over $2,800. So we're also seeing that amount needed slowly decrease. We did change our policy, so we are now only offering rental assistance one time per year through our funding sources. They can still access emergency assistance and emergency general assistance through our financial side one time in 12 months as well. So, they have going through the county, they kind of have two touch points per year that they're going to be limited to. Moving into 2026, we are going to see a decrease of approximately $600,000 in rental assistance again, right? So we had a slight reduction in 2025. Then, of course, there's some last minute one-time funding, but we will still see another reduction going down into 2026. The thing to remind those folks who have been here, I've been here a really long time, who have been here with me a really long time. Prior to the pandemic, you guys, we had only about $150,000 a year in funding that we gave away. So we still have $1.1 million. So we still are 7 times more than what we had prior pandemic. Granted, I know the needs are very different. So although we have another huge cut, we do still have significantly more money. And I think we're starting to stabilize, right? So I think there'll be another little dip because we had one-time FHPAP funding again this biennium, but we're kind of getting to where we will have at least some consistency moving forward, which will be helpful. And if any of you are watching the news, HUD's making some big changes, and we're watching it and we just don't know exactly what's coming our way. The NOFO, the Notice of Funding Opportunity that was just released, had some significant changes that makes Minnesota ineligible for a lot of different things because of the policies we have in place and how we value the people we serve. And so we're going to watch this and we're going to see what's going to happen, but this could have some big impacts, especially in our permanent supportive housing programs throughout the region. So more to come on that one. I will walk through this really quickly. These are just some pictures of our emergency housing services building. The things I want to make very clear, because I think this group is focused on families, this is an adult-only emergency housing. So you have to be 18 in order to enter here. And so just to be very clear, you can't be under 18 to come in. So it's located here. Highway 36 is right here. It's right here on this corner of the building. If you guys are familiar with the Minnesota sign, it's right next to that Minnesota sign. On a high level, we talked with people experiencing homelessness, and the things that were most important to them is they wanted to feel safe. So it's individual rooms that have locks and their own bathrooms. They wanted to be able to stay with the people they choose. So we have 7 double rooms that people can choose to stay together if they want to, or they can be in a single room if they choose not to stay together. We will have limited pets, mostly dogs. Again, there'll be some restrictions due to insurance. Always insurance issues. And then they will have additional space for possessions. So they'll have their room, and plus we have, think of an apartment where you have some storage cages, storage lockers in the basement. They'll at least have a locker to lock up some of their stuff in. These are the actual pictures of our building now that it is very close to completion. So this is the front. And this is our rear patio. There will be more patio furniture coming. I'm not sure if it'll make it this year with the snow on the way or if it will wait until spring. But one of the things is they really wanted access to outside space so they could be outside and in nature, and then, space for their pets. Not sure how well you guys can see this because I shrunk this down. This image is also will be on our website so people can kind of see. There are 30 rooms, and so with the double rooms, it'll be a max capacity of 37. Most of the spaces on the first floor are shared spaces, office spaces, the commercial kitchen, and we just have 4 rooms. And then upstairs are the rest of the rooms with 26 rooms. The one thing I think for this group potentially, I don't know how many of you may work with some of the folks in shelter, but if you do, we do have these flex office spaces. So this is reserved for programs that are working directly with the residents to have some private space and be able to meet somewhere other than their room. And then I just wanted to show a few images. So again, this has more shared space than a typical building. That was the other thing we heard is they want to have space to be social. So we have a rec room that'll be kind of a louder space for lack of a definition. This is an upstairs lounge, and then this is the pictures being taken from our commercial kitchen, so out. And so this is our cafeteria gathering space. This is the largest space in the building. Here's a quick peek at a double room. Again, it was hard to get the whole thing in. So one side right now has the 2 beds and the 2 chairs, and the other side has the dressers and the desks. And then just a quick image of the bathroom. Most of the rooms, or I should say all the rooms, have bars, shower chairs. They are fairly accessible. And then we have 2 full-on roll-in showers, handicap accessible rooms. And then I just ended on the picture. Are there questions? I went through that really quickly.
Did you mention when people are going to start moving in?
So we still only have our temporary certification, and so they're telling me it's going to be ready by Friday, or by next week. So we're hoping the second week of December. So we still have about 10 folks in our interim hotel program. They'll be given the option to transition if they so choose. We'll let them settle in, and then the goal is to open up 5 to 6 rooms a week. Stepping Stone Emergency Housing is our service provider. So they just hired a whole bunch of new staff that are busily training last week, this week, and next. And so we need to make sure that they're settled and ready to go. And so that goal is that second week of December, barring everything goes okay. They were unloading all the rest of the beds and desks yesterday, so that was fun to see. So hopefully, because most of the bedrooms are not furnished at this point, so it's down to the wire.
And then Sarah, why don't you speak of some needs that people might be able to help with?
Some needs. That's better on stepping stone things. So this is fully funded through state funding. I have 3 different funding sources. The one thing I didn't do is we have a commercial kitchen, so we are providing all of the food. One of our funding sources requires that, and so all the food. So what Stepping Stone I think is looking for is there'll be some donations for clothing, probably some winter items. They'll have a nice big clothing closet there so that if folks are missing something, we can help with that. We are required to do clothing, bedding, towels, toiletries. So that stuff is taken care of through our funding sources. So it's some of those other things. My guess is they'd still be looking for puzzles and some games. The library donated a bunch of books, so we have a shelf in there of books folks can read or take with them. I know that Stepping Stone, and I can get you guys the number, will also be coordinating volunteers if there are some. But I think it's going to take us, kind of a month or 2 to figure out what our exact needs are. And so they're kind of looking through that and figuring that out. So that's what I've heard so far.
Questions? Has there been conversations with Career Force and how they might get involved with helping people to find jobs or better jobs?
Absolutely. Yeah, and so we're going to give it a month or 2, and then they'll probably come in and either work one-on-one with folks, or we'll do some workshops there. So they'll bring on site. We have a large conference room, so they'll plan to do some resume building or how to do job interviews. Yes, they're very excited to come and bring their, kind of their core of classes to the building.
Nice.
Hmm.
Any other questions? Well, thank you, Sarah. There was
Yeah.
so much detail there, and
Yeah,
this is
sorry.
all just
It was a lot.
oh, it's good though, and so exciting, so exciting. Well, then let's go to Jacqueline. There you are, Jacqueline. And Jacqueline is the homeless school liaison plus many other roles at Stillwater High School. And so she's going to touch on what it looks like for families that are unhoused and what schools are doing to help.
Thank you, Sydney. Yeah, I actually service the whole district, so not just the high school. Yeah, so Stillwater, we see an increase in how many of our students are experiencing homelessness. I think we have about 15 more families right now than we did this time last year, which doesn't seem like a lot, but it's a lot. One of the big shifts for Stillwater this year is that we just have social workers at the elementary level, and then we have counselors at the secondary level to help support families. And they're not helping just with families who are experiencing homelessness, but they're helping with, all of the academics and the social and emotional needs and like the whole spectrum of things there. So what we do in Stillwater is we really rely on community resources a lot. So we connect with St. Andrews often to help families with housing. We have a group of fantastic women who donate gift cards for us for both gas and food, which is a huge help to families. And then a lot with like Valley Outreach and the Connect Center. So we are really reliant upon community resources and support for our families. One of our big goals this year is to really work on education throughout the district. So helping staff to understand early signs of potential homelessness, what community resources exist, and what our roles of responsibility are when it actually comes to supporting students and families who are experiencing homelessness. So I think that we might be under identifying, but that's also really hard to kind of tell. Most of our families that qualify for McKinney-Vento, they're eligible because they're doubled up. So not because they don't have a place to stay, but because they're staying with other friends or families. And then pockets, we have a lot of students at the high school, but I mean, that's because we have one high school, right? So lots of students at the high school. And then like the south side of our district also has more students and families who are experiencing homelessness than other areas. So I mean, yeah, just big overview. Let's say, I mean, we do put families up in hotels when they need to. We try to limit it to about 2 weeks, but if we know that they're working actively with the county or with a caseworker, then we can sometimes go longer than that. Our funds for that are also limited. We get some from Washington County. And then we also have some community members who also donate a little bit also. And then one of the things that we're doing this year is we're going to start setting up like hygiene closets in each of the schools. We haven't had that before, which is a little surprising to me. This is my second year at Stillwater, so it's a little surprising, but that is something we're going to do. And we'll work with the nurses, social workers, and counselors to make sure that those are in a place where it's safe, private. We're not like, exploiting that for everybody to be like, look, I need stuff. Yeah, I mean, that's just a really quick overview. I mean, for us, it's really about if we know that a family might be experiencing homelessness, we try to connect them with a social worker or counselor. We do that interview to see what their needs are. And then depending upon their needs, that's going to dictate what it is that we do next.
And Jacqueline, do you take donations of well, like what kinds of things that just individual, people could donate? What would some of those be? Like maybe some of those hygiene items, but maybe there's
Mhm.
other things as well.
Yeah, so that'll be new for us this year. So it's gonna have to be something that I can maybe connect back with you on what that process would look like in terms of donations for that. Um, Cindy, I'm going to throw you out there, but we don't take donations for gift cards straight at the district. We work with Cindy at the Connect Center to have them housed there. And that was really just on the advice of how like our legal team and our superintendent wanted to go about that, just to make sure it was completely transparent. And we didn't run into any potential issues that way. So thank you to Cindy for allowing us to use them in that way. But I think it's worked out pretty well. And then if there's donations or things that people want to donate, it's again, that's just kind of going to be like an individual, like we can go ahead and we can talk and we can work on that because we have to be careful with where we house those and then the process of how we track what's coming in. Yeah. I know there's a church, Watermark Church. And I know they're doing things for the holidays. And so our engagement specialists, that's what we call our cultural liaisons. They have a list of families along with the social workers and counselors who might have additional needs as we get closer to the holidays. And then they are ready to go anytime somebody's like, hey, we have access to this. We do have like a list of families that are generally in more need.
And I know that Southwash Cares has a lot of ways of gathering things that families from the schools that are unhoused in need. And I'm not sure if that goes like to all the different schools, if it's more of a Southwash kind of relationship.
I think it's more of a Southwash relationship. But I think if we needed to, we'd be able to tap in. Yeah.
Any other questions? I don't see any other questions. So I'll talk a little bit about the Connect Center. So we do serve a lot of unhoused people, both families and youth, and occasionally singles as well. Our work with youth is defined through age 24 federally, and so we do outreach. And then we also work very hard to get permanent housing for youth that are currently bouncing around. And we mostly do that through the coordinated entry process where we get them assessed. And there are a lot of youth housing programs, but unfortunately, they're not in Washington County. And so there's a number in the metro area and then a couple of other suburbs. And we've actually been very successful with getting a lot of the youth that we start working with into those housing programs. So we're super happy about that. Um, it's hard to often, you know, come into contact with youth that are unhoused because they are, just kind of bouncing around. And unless someone tells them that, there's this program, these people that can help you, they're not going to know about it. So one of our biggest challenges is just raising that awareness, which is hard to do in Washington County because we're a little more rural and long and spread out. Um, so I think anytime that any of us can share information that we're learning this morning, it does go somewhere and it helps. Um, so let's see. Families, lots of times families come to us and they are unhoused. And so then we're working to find them housing, which is hard to do now with housing being so unaffordable. The other thing that we help with is just, like families that we are working with long term and once they're housed, but then life happens, they lose their jobs. And so, then there's evictions and such. Um, there was mention, I think maybe Brianna mentioned the St. Paul Foundation has a community sharing fund. And it's so helpful because if a person does have that eviction notice, they have this court date, they're in jeopardy of losing their home. But if they are working and it looks like going forward, that they're going to be able to make their rent again. They will pay up to $1,500, which often is about, what the rent is. So we've helped a number of folks, a lot of single moms that lost their jobs, they got another job, but then they can't make that rent, to be able to pay that rent and then get reimbursed by St. Paul Foundation. So that is just one more way that we're keeping people housed so that they don't become unhoused. So and my heart has always lied with prevention. And so I think we always need to keep that in mind too, not just working within the house, but how do we keep people from becoming unhoused? Um, so that's another piece. Um, let's see. What else? Do you have questions? So I don't see questions. So um, just questions overall for anybody, or even comments that have to do with what you're seeing, just things you're wondering about, with anything that has to do with homelessness in Washington County.
Cindy, it seems like there's a patchwork of homeless programs around the county, but it also seems like you talk to each other a lot. What's the organization, or how do you make the fit between the group of you?
You know, there's one thing that happens on a monthly basis, and that's a heading home meeting. And that's for anybody, agencies, community members. Just it's a very open group. It meets once a month, most of the time virtual. Once in a while, we meet in person. But that's a really great way just to touch base, to learn, to share, and to kind of get updates. And it is the second Wednesday morning of each month, from like 9 to 11. So if anybody, would like to get an invite to that, we can definitely get your name on the email list. Mhm.
Thank you.
Mhm. Other questions or comments?
Hi, Cindy. This is Andrea Martinez with Health Review Community Partnerships Manager. Thank you for your time today, the presentations. It was great information. I'm definitely interested in getting emails and information about this group, so I'll put my email in the chat. And then I just wanted to say that it just resonates a lot with the needs and barriers that we're seeing from our patients when we screen for the social determinants of health. Housing is one of the main barriers, and it's usually the hardest one for us to get them referred to a specific resource. And that's also one of the reasons we invested in an online directory of low or reduced cost or free resources on not only transportation, food, housing, etc. And I'm interested in saying this because in case some of the programs would be in case you or some of the managers of the programs would be interested in listing their programs there, I can help you do that. And the advantage of this online directory, because we know that all the directories have its own challenges, is that this is being managed by a national team that updates the resources in there just to make sure that they're kept up to date, and that the directory, it can be used by anyone, not only by Fairview but anyone in the community. So I'll put the link in the chat. And again, it's not only for housing resources but food, amongst others. So if you're interested in learning more, connecting on how we could collaborate to list as many programs or initiatives in there, let me know. But yeah, thank you.
Yeah, thank you, Andrea. That's so important because so many people they end up unhoused because there's, rents are going up, and so are many other costs, food, insurance. And so any way that, some of those costs can be, you can find some of those resources for free or less, that's going to make a huge difference. I know that we have seen a lot of seniors that have rented all their lives, and now they're suddenly being evicted, especially like in these last couple years. So many seniors, that rented all their lives and now their incomes are fixed and the rents have gone up, and just that is so not right, but that is definitely happening right now. Any other last questions or comments? Well, thank you all to the panelists. It was such great information and updates.
Cindy, we want to thank you and all of you. The work you do, wow, so important and so educational today. Help us guide where to turn and who we can link with. So we appreciate you all. Thank you. Okay. Now is when we'll go around with any agency updates. So we probably should do some intros too. I think we have some new voices on the call with us. So if possible, I'll just call on, hopefully you stay on my screen in the order so I don't miss anyone. But it might be helpful for our panel members too to just see who else joins in these calls if you're joining for the first time or just a refresher. Hey, Dan, you're my first person up, Dan Purnell.
I'm always paired with you. Yeah, I'm Dan Parnell with NAMI in Washington County. We're just recently kind of had a little planning meeting for our 2026 outreach. We're really looking at trying to help the community, especially with youth and with young families. And what we're working toward in the next year is really going to be much more in terms of awareness that we're here and kind of the tripod, I guess, of education, advocacy, and support that NAMI does to make sure that we can get out into the community that way. I'll save a little bit of what we're doing right now for Janelle Olson, who's also on the call.
Hi, everyone. I apologize. I'm doing some multitasking here, but I've got some potatoes that just got done, so I'm mashing and listening. And anyway, we have been doing some good outreach to the churches, especially Trinity, and hosting some discussions. I hosted a discussion on the Our Stigma podcast, which addresses all the multicultural aspects of mental health and of our community. A little bit greater community in some ways, but I think I've got a team of people now at church who's very interested in partnering with NAMI and other mental health initiatives. And some of us went to see the emergency housing shelter on Monday when there was an open house. And that's mainly my update, I would say.
Thanks, Janelle. Always good to see you. Jerry, you're on my screen next.
Hi, good morning, everybody. I'm Jerry Klebish. I'm a social worker in the Children's Division at Washington County, and my primary role is I'm the coordinator for a project to bring family resource centers to Washington County. It overlaps with a lot of the work that I'm hearing at these meetings and even in today. We're still kind of in the early phases of getting it going. So the project is still between development and starting to offer some services. We don't have a location that we're set up yet, so we're primarily using a pop-up model, and we go into the Oakdale, Cottage Grove, and Woodbury libraries a couple of times a month each time, and just offer support in the way of navigating to community and county resources. So whether it's programs or services or anything that folks can connect with. We're also in the process of setting up parent support groups that I hope to get launched early next year. And then we do one-off trainings for parents and events for families. With the most recent one, we're hosting a legal support event for families related to family law for South Washington County. So yeah, so more to come, but we're just trying to get really the goal is to have hubs and locations where folks can go to connect to the things they need. So
Thanks, Jerry. Wonderful. Sheila, would you introduce yourself, please?
Good morning. Sheila Watercott, and I am the Regional Prevention Coordinator for the 7-county metro region. My office is in St. Paul with Association for Non-Smokers. I'm grant funded through Department of Human Services Behavioral Health Administration. So I saw that Kari Caldwell had dropped off. She's from Forest Lake with their Positive Community Norms grant, but they have an event coming up next week, a parent education event at the YMCA. So I will put that flyer in the chat. So a really cool event that they're putting together and maybe something we can look at replicating in other communities as well. So
Thanks, Sheila. And just a quick reminder, if you have events that you would like the Connect distribution to receive, you can email myself, but it really could go to Rebecca, and the same person that you get the meeting invites to, and then she'll add that. That would be great. Nikki, haven't seen you in a while. Would you say hi?
Good morning. Can you hear me okay?
Yeah, thanks.
Hi, I'm Nikki Dahlstrom from Washington County. I work in children's services, but I'm also interning on our mental health and motion van. So I'm kind of here under that role today. But I know a lot of you, so it's nice to see you all.
Thanks for the update. Awesome. Diane, yay, you made it today. Yay.
Hello, I did make it today. Happy to see everybody. My name is Diane Peterson. I am the lead social worker in the North St. Paul Maplewood Oakdale School District.
Thank you. Good to see you. Happy Thanksgiving. Kathy Walsh.
Good morning, everyone. Kathy Walsh, Washington County Juvenile Probation. I have a gender-specific caseload. I don't really have any updates, but I hope you all have a good Thanksgiving.
Good to see you. Jennifer.
Good morning, everyone. I'm Jennifer Andrews from Stillwater Community Education, and my updates are we are really still trying to implement a lot of mental health classes. We have a mental health grant through St. Croix Valley Foundation, so we've had some successes and we've had some things that not successful, so any input's appreciated. We did 2 book studies on the anxious generation in partnership with our libraries. They were wonderful. We're going to be doing 2 more this winter. One of them we're going to do in partnership with Community Thread. So we're excited about that. One of the barriers I have is daytime space. And so they have space. So we've been doing some other partnering with them. We have several courses we're offering through NAMI this winter. And also Selena Freimark's going to be doing a compassion resilience and navigating grief and loss. What hasn't worked is we've tried twice now to do mental health first aid trainings for free. And most recently, we had 13 people sign up and 2 people attended, and we can't do it with 2. So it happened on 2 different evenings. So if anyone has any suggestions on how to have that happen, because we have all these materials, and so even if someone's interested in offering that, I'd love to partner with you. We have district trainers who need to do so many trainings in a time period or they're not going to be certified. So I'm also concerned about that. But also, a lot of people just think it's too long. I don't know. I mean, I think it's very good training, but anyway, so that's what's up with us. Our catalog should be in the mail any moment, and it's online right now. So check out our offerings and please reach out if you are interested in ever partnering with us.
Thanks, Jennifer. Kelsey.
Good morning. My name is Kelsey. I am part of the mental health and motion van with Nikki. We don't have any big updates right now, just still working on finalizing our plan for winter and partnering to get into places rather than being outside with the van. So if anybody wants to partner, hit us up.
Thanks.
Happy Thanksgiving.
Thank you. Thank you. Hi, Stephanie. How are you, Steph?
Hi there. Good to see you. I'm Stephanie. Stephanie Lindy Kugel. I am also with North St. Paul Maplewood Oakdale, along with Diane. I this year have transitioned from more of a mental health support capacity in the district to McKinney-Vento foster care. So I help support our families that are experiencing housing insecurity and foster families. I still have a little bit of that mental health piece, providing therapists in each building, but a Project Aware grant ended this year, and so there's quite a bit of things that were sunsetted along with that. So good to see you all. Happy Thanksgiving.
Thanks. Samantha, Sam.
Hi, good morning, everybody. Um, Stabilization, wow, it's a Monday still in my head, and I'm off tomorrow, so I apologize. I'm just struggling this week. Um, so I'm Samantha Axt. I'm over at Washington County. I cover the crisis stabilization and our forensic case management team. And so I just wanted to say we don't have a whole lot of updates for stabilization other than just send us your referrals. Something I keep kind of putting a little buzzword out there is that after kind of during the winter, I'm going to try to connect a lot more with some of our school contacts just because we want to work with you on maybe not necessarily not that we don't want you to go to crisis response, we want you to utilize crisis, but we do know that there are some kiddos that might utilize crisis response a lot, and maybe we can bypass that and have them directly come into crisis stabilization. So I want to start having those conversations to help support that. Otherwise, I hope everybody has a good Thanksgiving. If you're bored, turn on Pluto TV, the Chicago Thanksgiving Day Parade. I will be in it. So it's free to watch. So if any of you guys have kiddos at home, you can point out to them that you know a real life princess. So I'll be walking with the St. Paul Winter Carnival. So just wanted to throw that plug out there too.
So exciting. Go. Leah, are you able to jump on, my dear?
I am. Hi, I'm Leah Berg with Washington County Public Health. I just have a few updates. I work primarily on the Statewide Health Improvement Partnership or SHIP grant. And our new cycle of funding for a new 5-year cycle just started on November 1. So I have a funding opportunity to share for any businesses in Washington County looking to work on worksite wellness. So businesses can apply for up to $5,000 to work on physical activity, healthy eating, tobacco cessation, mental well-being, and breastfeeding support. So any organization that is located within Washington County is eligible for funding. I have the link to the application and just some guidelines. So if you have any questions about that funding opportunity, please feel free to reach out.
Wow, that's exciting. Thank you. Good to see you. Lori, could you jump up and give us some updates on what's happening? I saw you in the chat too, so I don't know if you can. Okay, I'm going to hold on that. Lori, if you can join us, that'd be great. Ivy.
Mary, I could jump in really quick. Sorry, my camera's not on. I'm about to be driving, but this is Becca Layton with Washington County Public Health, and I'm jumping in because Ivy is our newest addition to our team member, the Healthy Communities team, and she's filling in. She's taking over Kathy Macwich's role, which I know a lot of you know. So she can introduce herself, but I wanted to give some of that background.
Thanks, dear. And Ivy, I see you now.
Yeah, thank you. Just had a little bit of a technical issue, but yeah, my name is Ivy. Yesterday was my first day, so I will be a community health specialist at Washington County with the Healthy Communities team. But happy to meet you all and happy to be here. So thank you.
Well, great to meet you as well. Thank you. Thanks for stepping up. Is it Alana? Can you step in? Oh, come back, Molly. Molly, I don't have Alana yet. So, oh, go for it, Alana. There you are.
Sorry. So I'm Alana. I'm the Abuse Response and Prevention Services Supervisor at Campus Health. No large updates here. We are fully staffed now, which is great, and have been really, really busy on that coming the end of the year to here, and we're just waiting to hear back and if we got some grants that we applied for or not. So send some good vibes our way. Otherwise, that is it, and happy Thanksgiving.
Thanks. And Alana, do we have you in January?
Maybe, yeah.
Okay.
Yes.
Great. More soon. More to come.
Yes.
Molly, could you go next, please?
Yeah, good morning. I'm Molly Cirillo, and I'm a district lead social worker with Hastings Public Schools, and I do our foster care, McKinney-Vento, and a crisis, all of the things. We're a tiny little pocket in Washington County, so we don't interact a ton, but I do like to be looped in on things because you guys are doing a lot of great work in Washington. Thanks for having me.
Oh, I'm glad you're here. Thank you. I'm reading my names. Who am I missing? Fua, can you say hi? I don't know if you're able to jump in. Yay.
Hello, everyone. Fuachua with Blue Cross Blue Shield. How are you, Mary? I've missed you. I was on sort of a break. I had a baby in January, and I'm just finally catching up. So I do apologize to this group. Um, so you all have heard that UCare is with Medica now. So Medica has bought UCare. That is official. Blue Cross Blue Shield is still here. We're here to stay. We're changing a little bit here and there with the economy and with the moving tides, but we're here to stay. Um, Not on behalf of Blue Cross Blue Shield, but I'm also an SHW instructor with Normandale, and we're looking for internship sites. So you would get a community health worker for 80 hours, and we're looking for internship sites in the spring of 2026. I've got some fabulous students who are looking to, if you offer remote, good. If you want in person, we can make sure that you get somebody or try to get some interviews in with you. And a couple things I just found out about, if you want to become an internship site, you don't have to be a registered 501c3 or business with the Secretary of State. If you're a collaboration or a coalition and you've got some things that you want community health workers to help with, like building a campaign around mental health awareness, ramping up to May or something like that, please reach out to me. I'd love to make sure that these community health workers get connected. That's me. Thank you.
Great. Good to see you, dear. And what a great opportunity. Okay, now I think I see you. Chelsea, can you jump in there?
Hello. Sorry for my glare and then also my dog here. He's pretty much Velcro if I'm home. But my name is Chelsea Flores. I am a fire captain, paramedic, and community paramedic for Cottage Grove Fire. I just got home from shift, so he's loving it. But I just want to jump on. I don't really have any updates, but it's really nice. It was a really great presentation. I didn't have any follow-up questions because it was such great information that was just really direct and informative. So thank you for that. And I just it's nice to be able to see people and connect with people, so I can know where I need to reach out in the community. So thank you so much.
It's so cool that you come. So thank you. That's
Oh
great.
yeah, thank you. I appreciate it a lot.
Marta, can you jump in?
Yes, I can. I am the clinical supervisor for school-based therapists for Family Means, and we're in District 834, which is the Stillwater district, in all those schools, and also some of them in 622. So good to see Stephanie again. I've missed you at the conference and such, but we don't have not a lot of new updates. I would just say, particularly at the high school levels, we are seeing long waiting lists. And sometimes there's a bit of a disconnect because the waiting lists are pretty long, which is purely a factor of not having more time that we're able to give at those schools, but also, and I don't know what is related to what. I don't want to make any assumptions, but we're having more trouble with getting parents to fill out the necessary paperwork. So when they get referred, they come to us, then they receive paperwork pretty much right away. And so we're kind of working on whether that's a language barrier or people are don't have the technology they need. So kind of working on that, but there's the need for that and for the school-based therapy, which helps remove barriers for families, of course. So other than that, no new updates. We're cooking along.
Thank you, dear. Good to see you. Lisa, I think you might be my last one, but then if I miss anyone, because everybody jumps around. So please let me know if I miss someone. But Lisa, would you go next dear?
Yeah, hi, good morning, everyone. I'm Lisa Wong with Washington County. I'm a senior community health specialist on the Healthy Communities team. Just a couple updates. We are preparing our funding for schools. We'll be doing an open call this year, and so keep an eye out for that in the next couple months. Hopefully month, and that will be largely focused on mental health and well-being in the schools. So certainly I'll share it with this group. And then additionally, we have a trauma-informed care foundations training. It's a 2-day, 8-hour training, January 27th and January 29th. from 12:30 to 4:30 at the Discovery Center in Oakdale. So we certainly welcome any practitioners and any folks wanting to learn a little bit more about trauma-informed care to sign up. And I can put that link in the chat for signups. I don't have a flyer yet, but the link is available. And I think that's all I got. Thank you all.
Thanks. Great stuff. Great stuff happening. Becca, you were so kind to jump in and introduce Ivy. Did you have more to add? I'm so sorry. I feel like I cut you short.
No, you did not. That is great. My team covered all of the updates. Lots of funding coming out. So keep an eye for that. And then a reminder, if anyone has anything they want promoted, to send to me, like Mary said at the beginning, and I'll get it in the monthly email to go out in a couple of weeks.
Thank you. Appreciate it. Lori, did you have a chance? Did you have anything you wanted to add, dear?
Yes, I'm sorry. I missed my name there. But I'm Lori Schmidt with Anoka County Community Action Program. And I always say, even though it's Anoka County, we do cover Head Start and early learning scholarships in Washington County. So Head Start right now, so I should say the sites in Washington County are Forest Lake, Newport, and Oakdale. They're not at 100% enrollment, so they're always willing to, enroll children. And I did put in the chat our website there. Early learning scholarships, we just got the okay to make some awards, so we're going to be working on that. Of course, they told us, yay, now you can award money, and then we're waiting for the money. So it's been a couple weeks, but there's a lot we have to do to get going to set those up. So the other thing I wanted to mention, I'm on a committee in Anoka County called Heading Home of Anoka Housing Collaborative, I think is what it is, HHAHC. And they just had a very successful event. And I saw that Joan Mellor was on the meeting today, but she stepped away. So in Washington County, they do pit events, and they've had them twice a year in Stillwater, once a year in Cottage Grove, and once a year in Forest Lake. And so Anoka County just had a similar one. It took them years to get on the ball with that, but they offer all kinds of resources, gas cards, food cards, immunizations, legal aid. I think they can get food. They have a meal throughout the day, breakfast, lunch, snacks. There's events for the kids, crafts for the kids to do. And I'm just trying to think when the next event is. The pit event in Stillwater. It's going to be in January. So in Stillwater, they do January and July. And I believe Cottage Grove was that August? Or that might have been October. And then Forest Lake was in March. So the turnout is always great. They always get, like 200 to 300 people showing up. So we're hoping that with all these resources, people are getting help. The help they need. So, you know what? I'll look it up and see if I can find. It should be on a Thursday.
I have it.
Do you have it? Oh, good.
Yeah, it's January 26th at First Presbyterian
it's a
Church
Monday.
in
Okay.
Stillwater.
Okay. Yes.
Yeah,
yes.
actually, our last one was in Cottage Grove, and they had 650 people
Oh
come.
my gosh! Wow. 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 That's amazing. So it's wonderful things like that happening that we're glad to see. Anyway, I think that's what I have. Thank you.
Thank you. Thank you. Any last updates and forgive me if I missed someone. I think I got everybody. You know when someone talks, you jump around on the screen. You've seen this. So hopefully I didn't miss anyone. Any updates for me? Let me think. Just been really beautiful, wonderfully busy with parent coach stuff. I have contracts with some schools. I just wrapped up Screenagers 3 middle school, and then they market it to their elementaries in Mounds View School District. Over 600 people attended between all 3 of them. So it was thanks. It was really beautiful. It was a really cool platform to follow, to have that much going on. So thank you. Good to see you all. Any last wonderings, questions? Thank you for hanging out till the end. We're ending a bit early today, but please know we do not meet the fourth Tuesday in December. Go figure, you know, it might be a holiday week or winter break, whatever your school district. And then we're back in January with this group. Always the fourth Tuesday of the month, twice a year we meet in person. Otherwise, it is virtual. So, and we're exploring who's missing from joining these meetings. That's what the leadership team is working on. Like, who else should we be reaching out to and make sure that their voice is being heard at our table too? So, on that, I think y'all should go and enjoy your day. And get ready. Are we getting snow? Yay. Here we go. Great to see you all. Wish you a great Thanksgiving.
Yes, happy Thanksgiving.
Take care.
Yeah.